Good morning, everyone. What a wonderful year to start today with very knowledgeable session that we have on electrical safety in hospitals. So today, the 7th of January 2023, the first webinar by CAPE and NFE. So the reason that we wanted to start today's webinar towards focusing more on hospitals, there is improper electrical system, poor planning, non-compliance to electrical standards, and poor quality installations. So today we need to understand what is causing these electrical short circuits in hospital, especially on the equipment. So there are over 120 people who died till August 2020, and more than 140 reported incidents in the hospital our installations. So today, Mr. Gopakumar going to highlight more on the reasons why this is occurring quite often in hospitals. So with me, I have very distinguished guest, Dr. Lallu Joseph, who's the General Secretary of CAO, and also the Quality Head of CMC. And also we have our colleague, Amaya Shaji. So I would like to introduce NFE, National Federation of Engineers, very focused towards electrical safety. The first time in the country, we have formed an association for electrical safety. NFE stands for National Federation of Engineers for Electrical Safety. So we are going to kick off on 26th of January, enrolling the membership, and we are going to come out with what is our agenda, the vision and mission of NFE, and what are the areas that we are going to work, and how we will be complementing the government of India or to the nation development through NFE. So Mr. Gopakumar is the president-elect of NFE. I'm sure that everybody will be quite interested to know more, and we will be coming back to you soon with more details. And this webinar is sponsored by CAPE. Most of you know that CAPE has been the inspiration in doing last 2022 webinars in the year 2022. Over 19,000 people attended. Myself, Dominic, been in the fire industry for quite some time and founded many associations and this thing. So NFE is the new baby, and also we have started Indian Society for Brave Hearts, identifying the people who sacrifice their life for saving others. So this is something that new coming out in 2023. I have a very distinguished guest today, Dr. Lallu Joseph, who is the Quality Head of CMC and General Secretary of CAO. Most of you would have heard about her. She's a mechanical engineer by profession and is a quality manager and accreditation coordinator for CMC Vellore, which is the largest in the country to be accredited by the NABH. She has written many books and published articles, member of NABCH and committee member of developing guidelines to develop guidelines for NABH standards, a joint initiative of NABH and World Bank. She was involved in overseeing the implementation of QMS in selected government hospital of Karnataka through consortium of accredited healthcare organization called CAO as a part of World Bank funded project, and part of the task force of Karnataka Knowledge Commission implementation on procedural costing. She developed the basic and advanced certified professionals for quality implementation in hospital program for CAO, which are well sought after, and also 7 one-day programs in CAO. She's a passionate teacher and a trainer, and involved in training quality implementation across the country through NABH, CAO, HPA, and also the faculty of many hospital administration program. She is the principal assessor of NABH and trainer for NABH. She always inspires me, the way she presented, the way she put it across straight on the face. And I'm so proud that we have today as a opening remark. She'll be doing it. Along with me, I have another well-known face, an international speaker, Mr. Gopakumar, who is the managing director of Cape Electric and president-elect of National Federation for Engineers of Electrical Safety. He's having more than 27 years of experience in electrical safety, lightning protection, and EMI and EMC. He has carried out over 100 site studies on failures analysis of electronic equipment and hundreds of electrical accident analysis, including various fire accidents from electricity. He conducted more than 1,000 training in various countries on the subject of his expertise. He has published articles about safety in various magazines and the book called Missing Link, which is now in great demand. As he said, he is an active member of working group in IEC and BAS and NEC. He is now today he is in Delhi. He was part of the in BAS Founders Day yesterday. Yesterday also, the news NEC standard was released, and he played a major role in the preparation of the codes. With me, I have one of my colleague, Amaya Shaji, who's a biomedical engineer with 6 years experience in the healthcare industry, familiar with working environment of hospital across Kerala, worked along with doctors of most critical as well as sensitive parts of hospital, assisting them in providing support during various medical activity. Currently, she's working for CAPE in the region of Kerala. I wish all the best to Amaya, and I would now look forward to hear from our keynote address, Dr. Lalit Joseph. And I'm also thankful to her for partnering CAO with NFE for this webinar. Over to Madam.
Thank you very much, and very happy New Year, everybody. Thanks for that round of introduction, Dominic. It's indeed a very proud moment for us. We are starting our webinar series with our new partner, National Federation of Engineers for Electrical Safety. Safety is part of the DNA of CAO, and I thought I'd use this opportunity to introduce CAO to our audience and thereafter talk about the importance of electrical safety and how to ensure electrical safety in hospitals. I'm extremely happy that you've chosen this theme for the first webinar that you're hosting, and must acknowledge and appreciate you for the efforts that you all have taken towards sorry about that. So would certainly like to appreciate the efforts taken by your organization towards taking this up as a challenge. This is the need of the hour, and I'm sure all of us agree with the number of registrations that Dominic was talking about. It is quite evident that electrical safety is the need of the hour. So before I begin, I would request the CAO Secretariat to put up the CAO anthem. That is just to tell you what we do at CAO and how this is very much important for us. Over to you, Meenakshi.
Of healthcare delivery and patient safety. We have a noble drive. Hand in hand, step by step, we will try. joining hands for building a vision, shaping a culture for patient safety.
Setting up standards with best foot forward. Won't ever leave no stone unturned.
We wear our pride on our sleeves, work with passion like a breeze, training people, enhancing their skills, spreading the message of quality healthcare for safer patient care, a better nation.
We have a goal,
We have a goal,
a noble drive.
noble drive. Hand in hand, step by step, we will thrive to march ahead together for a bright and shiny future with patient safety and quality healthcare. We are AHO Kaho, your healthcare companion, standing right by your side.
Sorry about that buffering, and I'm sure our team will share the Kaho anthem to you through the chat. And that's Kaho for you. Kaho, the consortium of accredited healthcare organizations in India. We are established to promote quality, patient safety, and accreditation in this country. Patient safety is part of the DNA of Kaho, and I would encourage all of you to join us in this journey. And I'm extremely proud and privileged to be part of this association, National Federation of Engineers for Electrical Safety. Because as I mentioned earlier, this is the need of the hour. Most often we talk about fire safety, the fire accidents that happen. In healthcare, we are all aware of the number of hospital fire that happened in the last year. More than 200 people have lost their lives, patients, healthcare workers also included in the list. And during COVID, we saw the magnitude of the hospital fires that happened. Now, all this, we talk about fires, but the major reason for this often would be the electrical aspects. They are all predominantly 90% are due to electrical fires. So what have we done towards ensuring electrical safety in hospitals? This is an area that is not talked about much in healthcare. And, as we construct hospitals, though we know these are areas to look into, we often ignore them, or we don't have the expertise, or we don't have the know-how as to what to look out for. So that is why Kaho thought it's extremely important that we associate ourselves with subject matter experts to learn from them, because the healthcare industry today needs the expertise of people from these specific domains, so that we learn and we don't make the same mistakes as we correct our systems. So electrical hazards are more common than what we realize. So planning a hospital, to ensure electrical safety, while we are planning a hospital, it is extremely important that we ensure electrical safety, and not just planning. While we are renovating or while we are working in our own system, we can spend some time, efforts into looking at the electrical safety and making sure that we are compliant. And what I understand is electrical safety is a topic that needs to be talked. We are somehow reluctant to talk about electrical safety, and we think that that is for electrical engineers. And what I have noticed as part of my accreditation career is that in the last 13 years, the hospitals that I have visited most often have engineers who are probably from the civil or mechanical engineering background, predominantly diploma engineers, and there are people as consultants helping them from probably the corporates or otherwise. And you have electricians rather, working under them, managing the systems. So the expertise is very limited to day-to-day maintenance of the existing facility. People don't spend resources on looking at the safety of the electrical installations that probably were put in place 20 years, 30 years hence. And with added equipment, it is, when we start a hospital, it's probably just 20%, 30% occupancy. And as we grow, we keep adding equipment to the load. And at that time, we don't plan properly. We think the existing load will take the need of the other load that we are adding. So it is not designed properly, and from the existing load, it is all taken, not in proper manner, not using proper contractors also. So the safety of these systems, they are never ascertained. And we don't strictly carry out electrical safety audits in our installations, in our setup. So those are becoming almost like norms that we have to do them properly in order to prevent fire accidents from happening or losing very expensive equipment. We notice that there is downtime, and when we look at the downtime of the equipment, it is often related to improper power supply, not connected properly to the UPS, or there is a problem with, even using extension cords. We don't use proper extension cords. And we are also compromising on the safety of healthcare workers and the patients, by not using isolation transformers in wet areas like our ICUs or theater complexes. So we don't know them. That's the problem. Once we know, I'm sure we'll be able to rectify all that. So that is why CAHO is very keen to take this educational drive across the country to make sure that our engineers, our administrators, our managers, our doctors and nurses are equally aware of the problems with electrical safety in our hospitals. So that is becoming like, it is, I think it is more important than just talking about outright patient safety with wrong patient getting operated, which are probably once in 10 years that we have one. But electrical safety, fire safety related issues are kind of becoming inherent to our system today. So that is something that we have to educate ourselves to. So I'm extremely happy that we have tied up with NFE to take this journey forward, because only when people with the right passion come together, we'll be able to address the nation, because this is a national initiative. And this is not something that is just limited to certain hospitals or certain groups of people. It is from the doorman to the chairman that everybody needs to know the safety aspects linked to electrical safety, by which we can have very safe hospital setup. And I'm very thankful that Mr. Gopakumar, Dominic, and all others who are in these organizations are as passionate or even more than all of us have. So I strongly believe, and CAHO strongly believes, it is the love for individuals, it is the love for professionals that can actually have the quality ecosystem and patient safety ecosystem developed in our country. And we are extremely happy and proud that we have partnered with people who are much more passionate than us in their subject areas. So thank you very much for giving us this opportunity, and we look forward to many, many more educational drives through you, and very happy to have partnered with you. Best wishes to you. Our support is always with you. Thank you so much, and Happy New Year to all the participants who are here. Thank you, Dominic.